In today's video, I want to go over 5 tips to help you be successful in residency. I'll gear it toward ophthalmology. Let's get into it. What's up and welcome back to the channel. I'm Zach with Dr. Eyeball MD. On the channel, I am trying to help ease your path through medicine and show you my path as I kind of figure it out along the way. So in today's video, I want to give you a few tips, 5 specifically, to help you be successful in residency. This applies to really any residency, but I'm going to gear it a little more toward surgical residencies and more specifically ophthalmology because that's what I do. So first, I think we should define our terms and kind of establish a definition of what it means to be successful in residency or medicine. So for some people, I think the definition of success in residency would be to get them to the next step, which would be getting into the fellowship that they want, getting into the job that they want. For some people, it might be doing well on their OCAPs or their boards. For others, it might just be getting through the residency. But another way of kind of defining success in residency, and it's kind of the way that I looked at it, and this is what I told programs that I was looking for when I was applying for residency. When they asked, what are you looking for? I said, I want to be good at 2 things. I want to be good clinically, and I want to be good surgically. That was the only criteria that I had. That's pretty much what I wanted. I didn't care so much about, having the Ivy League name or having a lot of research exposure, that kind of thing. To me, what mattered was being a good doctor, having the ability to reason clinically, and to have good hands surgically. Those are really the only 2 things that I cared about looking for a residency. So that's kind of what I'm gonna define as our definition of succeeding in residency is you being good at your craft, your specialty, and being good at it in the terms of that specialty. So for ophthalmology, that means being able to reason clinically, make good decisions, and be a decisive person in the clinic and make the right decisions. And then surgically, just having good hands, being physically good at it, and being mentally good at it, knowing how to make the right decisions, how to keep your calm when situations get rough, and that kind of thing. So that's kind of my definition of being successful in residency in ophthalmology. So let me go ahead and give you the tips to try to help you achieve that goal. Branching off of that, tip number 1 is to decide early in residency what you want to get out of residency. When you get to these higher levels of education, you really have to take the education into your own hands a lot of the time because no one's going to guide you through it. They're not going to handhold you at this level of training. So it's good to go ahead and kind of decide what it is that you want from the training. You've got 3 years in the case of ophthalmology to get out of it what you want. And if you define those specific goals and those specific kind of checkpoints that you want to reach, you're going to be a lot more likely to actually achieve them than if you're just kind of going through the motions and just kind of not going anywhere with any purpose and kind of aimlessly going through it. Now, fortunately, residency is structured enough that it is going to guide you in the right direction, but if you will go ahead and pick out some key goals that you want to get out of your residency, you will be able to get a lot further. To give you an example, for me, one thing that I wanted to get out of residency is that I wanted to be very good at cataract surgery. I wanted to feel very confident to tackle most situations that I would encounter with cataracts and feel very competent and leave residency knowing that I could go out and just feel very comfortable with that surgery. I didn't want to feel nervous after residency, and so that was one goal that I set early in residency and then focused very hard on trying to get good at by really studying, watching a lot of videos, and really trying to master that particular surgery. So try to have some foresight, look down the road at where you think you're going to be in your career, what you think you're going to need in that career, and how your residency can help you get that. They're there to help you, they are there to teach you, although it often may feel like you are there to work for them, and while you are, you need to make sure that they are reciprocating and really giving you the education that you want. So go ahead, define those goals, and then ask people that can help you achieve them, whatever they may be for your residents. My second tip is to make sure that you are learning for the right reasons and that you are learning in the right way. There is a type of learning that we do in elementary school, middle school, high school, college, where it's a lot of memorization for the sake of memorization and for the ability to regurgitate things. And when you get into medicine, and even it's kind of like that in med school too, but when you get past medical school, it starts to become where it matters if your knowledge and the things that you have learned are able to be put into practice and able to affect change in your patients. So what I'm saying is, don't just get to the point where you're very good at picking a multiple choice answer and just spitting back rote memorized facts that really don't have any clinical significance. To give you an example of the way that you might learn for the right reason and in the right way is when you go to clinic, when you go see a patient in the hospital that has something that you haven't seen before, have the humility to admit that you don't know exactly what's going on, or that you don't know exactly what to do, or that you don't feel very comfortable with it, and then go home that day and just really focus on that one single thing, that one single problem, and really deep dive into it and really just understand it. This goes back to a point that I've said before, and that's if you can learn just one thing a day, every day for a year, you will be miles ahead of anyone else in your class, because most people don't think that way. And so really focus on truly understanding and learning one single thing a day. You can start with one single thing every couple days, and then once you get a little bit better at it, do it every single day. So there is not really a day that goes by where there's at least something that I don't know exactly or feel very comfortable with. And so if I go home and I just focus on, for that day, learning something that's, even if it's very small and it seems like, well, I should be learning a lot more and not just this one little thing, if I didn't know it the first time and then I go learn it, the next time I come around to it in the clinic, I'm gonna know it. Use your experience in the clinic, in the wards, seeing patients. Take a specific instance where you don't know something and go figure that thing out. Deep dive into it, find a lot of resources, find videos, find books, find Wikipedia articles, find iWiki articles if you're in ophthalmology, and really deep dive into that one topic rather than trying to just study a ton of stuff all at once. It'll be a lot better down the road if you can deep dive on one single thing at a time and really truly understand that one thing. So make sure you're learning for the right reasons. Learn to be able to affect the change you want in your patients, and learn the right way by going vertical and having more depth rather than breadth in your studying, and then just doing that on a repeated basis. It will add up. It feels small at the time, but doing that every day will add up. Tip number 3 is to practice something related to your specialty 10 minutes a day. Now, when I was a med student and I was on the surgery rotations or the obstetrics rotations, we would do a lot of suturing, and I wasn't good at suturing, so what I would do is tie dental floss to my steering wheel, and anytime I was at a stoplight, I would practice the suturing to the point where I got faster than anyone else at one-handed suturing with either hand, and one-handed tying rather, and being able to do that. So whether it's that, if you're in a surgical specialty, you can buy cheap versions of whatever tools you use in surgery, whether it be needle drivers or Castro Viejo needle drivers or pickups or anything like that. You can buy these things for less than 10 bucks on Amazon, and I'll just keep them around the house and pick them up and just hold them. Just having that in your hand and having that tactile sensation starts to make those instruments more of an extension of your body and extension of your hand, so it becomes less of a foreign thing to you when you get in the OR. If you're constantly holding them, if I'm constantly just picking up the instrument, twirling it around, spinning it, feeling how it moves through my fingers, that stuff makes you better in the OR, believe it or not. If you're not in a surgical specialty, do something else that pertains to a niche or kind of a particular skill set within your specialty, even if it seems very small, that'll just push you a little bit each time to getting a little bit better, a little more comfortable, and make you that much better. Just practicing a little bit each day is going to solidify things a lot better in your mind, rather than just doing them on the day of, rather than doing it game time. If you will practice it over and over, day after day, you'll be much better. So that's tip number 3. Find something in your specialty that you can do 10 minutes daily at home while you're sitting there on the couch, and just do it repetitively. Tip number 4, and this one is a hard one, is to be humble, have humility, and realize that residency is the time to feel stupid, the time to feel dumb, and don't feel bad about asking questions that you think are going to make you sound dumb. It's going to be a lot better to feel dumb now while you're in training than to get out in practice and then still have those same questions that you were too afraid to ask and feel dumb then and have no one to ask. So realize that there are people that know more and that have more experience, and just be humble and ask those people how they do what they're doing, how to get better at things. Don't try to impress people to the point where you are trying to come off as someone that's already very, very good at something when you're still in training. This is the time to be humble. This is the time to try to build your skills and just admit that you don't know everything at this point and that you're trying to learn. So ask everybody that you come in contact with. You can learn something from everybody, and then you take that, you synthesize it. You're a doctor, you are a smart enough person at this point to be able to take all these ideas and kind of decide which ones you think are right, which ones you think work the best, and then synthesize all that information into your own. And so just be humble, realize this is the time to make mistakes. This is the time to experiment, ask questions, and feel stupid. Don't feel bad about it. Tip number 5 is to talk to everyone. Talk to the other residents, talk to the fellows, talk to the attendings. Get their ideas, get their perspectives on things, and then try to amalgamate that into your own thing. If you follow my channel, you know I like to try to design different surgical instruments and try to improve on things. And one thing that I have found very helpful is to ask pretty much every attending, every fellow that I come into contact with, like, hey, can you think of a better way to do this? Or how would you do this? How would you redesign this instrument? Or because they are the ones in that particular subspecialty, where do you see a need for bettering something, you know, that you use on a day-to-day basis, like a surgical tool? Where do you see a need and how would you do it? And then I get a lot of opinions, and people will say things that just give me ideas and spark things, and I start connecting that stuff and try to build all of it together in the process of innovating. So you can use that even if you're not interested in like surgical instrument design or anything. It's important to ask people their opinions, their ideas, and their kind of philosophies on things, because it will spark ideas in you that you haven't even thought of or considered. Even if you don't agree with what they're saying, a lot of times it will kind of open up new avenues of thought for you. So that's one thing I recommend, is kind of getting everyone's thoughts, everyone's opinion on how they practice, their philosophy on things, and then I can pick and choose and cherry pick, put all that together and make it my own, and kind of just basically steal from people that already have a lot of good ideas. I can borrow that and I can give them ideas. It's more of a collaborative thing. So that's the 5th tip, is to be open and really let there be an open flow, open source of ideas. All right, if you've made it this far, I'll give you the bonus tip, and the bonus tip comes from a quote that I like, and I'm gonna paraphrase it because I don't remember it exactly, but it basically involves finding the smartest person in the room and hanging out with that person. And if you find that you're the smartest person in the room, go find another room. Basically, the underlying message here is that if you are at the top of your field, or if you are kind of not around people that you can learn from, you're in the wrong room, you're in the wrong field. You need to go find people that know more than you. It's important to not be the one that knows the most in any kind of group of people in your specialty or your practice. So this is something that I've applied my entire life. When I was taking martial arts when I was younger, I would make it a point to try to spar or fight with the person that I knew was better than me, because it made me better. And I knew he was going to beat me most of the time, but I knew that I would slowly get better by doing that. Even though it was more uncomfortable, it's a more important thing to do. And while it is often more uncomfortable to not feel like you are the brightest person in a group of people, if you will hang out with those people, you will slowly start to become more like them, and you will find that it helps you improve. So find somebody in the specialty that is doing what you want to do, or that is doing something inspiring. Hang out with them, offer them some sort of value, try to help them in some way, and they will reciprocate that oftentimes. So that's the bonus tip, to hang out with people that are above your level. And if you can't find anyone, go to another group, find someone that's better than you, and try to learn from that person. All right, guys, those are a few of my tips to try to help you be successful in residency, kind of just to help you focus your mindset and help you know the way to think about learning, the way of pursuing knowledge, and the way of honing a craft in residency. Don't think of it like college, don't think of it like medical school, because it is different, and I think you should go about the learning a different way. And I think if you're gonna be successful, you're gonna wanna go about it a different way. Hopefully that video was helpful. If it was, check out one of my other videos. I'm Zach with Dr. Eyeball MD. I'll see you guys in the next one.